Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin and I'm here to talk to you today about a question that comes up quite a bit. What happens if an implant doesn't fuse to the bone? In other words, you put some mini implants in, you put 8 or 10 or 4, and everything seems okay, but a week or two later, you feel some movement on that implant. What do? Well, let's talk about a denture stabilization situation first. Let's just keep it simple. 4 mini implants on the lower jaw. You put 4 in, a week, 2 weeks, 3 weeks, 4 weeks later, one of the implants is moving, it's a little tender. What do? Well, what you do is you just simply remove that implant with a finger driver, take it right out. Normally you don't even have to give anesthetic for it, but if you're going to go ahead and place another one the same day, of course you're going to numb it up a little bit. You're going to remove that implant. My recommendation is just go ahead and get a new implant, same size in most cases, and move a couple millimeters left or right depending on the situation and make a new pilot hole in fresh bone and place another mini implant in that fresh bone site. Obviously you'll have to modify the denture, take the housing out, pick up a new housing in the denture, snap it in, and the same protocol again, have them wear it for 24 to 48 hours before they take it out and come see you after a couple of days. That's a simple fix for a denture stabilization problem. Same thing in the upper jaw. If you lose one, move it over a couple millimeters, place a new one. Don't use the same implant because it's obviously got bacteria on it and whatnot. And put a new implant in and pick up a housing and give that a try. Now, the more difficult situation is if you put a mini implant for a crown and a couple weeks, 3 weeks, 4 weeks later, the implant's loose, the crown's loose. If you've already cemented the crown, what do you do then? So what I do normally, if it's got a crown on it, I'll use a crown tapper. I'll tap the crown off with the implant. Obviously, you're going to numb them up. Pull the implant out with the crown. Most times I'll go to a larger diameter mini. So if it's an O-ball mini with a crown on it, I'll go up to a Milo 3.0 or 3.75 and go right in the same socket, screw it in the bone, and take the crown off of the implant that failed. I'll flip it over, cut a little trough around the implant to loosen it, take the crown out, clean out the cement, and usually you can cement the crown right back on if you position the implant properly. Okay, so that's another simple fix for a single tooth. Now, if it's a multiple tooth situation where you've got a bridge or a temporary bridge, I really like our new mono implants. If you have a failed mini, you can go right in with a larger mono, a 3.3, 3.7, or 4.2 mono, and go right in that bone and really engage solid bone. And that works usually very well. But the important thing is to re-drill the hole, clean out any granulation tissue, drill the hole with a little larger drill, and then go in with that mono and engage the larger bone, the dense bone, with that mono implant that's got very heavy, dense threads. So those are the ways I solve problems with failing implants. If you want to, you can just take the implant out and wait a while. That's perfectly fine. You don't have to go back in the same day. Take it out, clean it out, let it heal. If you want to pack some bone in there, you can do that. Pack some osteogen in and just let it heal for 4, 6, 8 weeks, and then go back and try again. So those are all solutions to mini implants that may not integrate or may fail after time. If they don't work, listen, we're going to have failures. We have about 93, 94% overall success, which means 5, 6, 7% of the implants we place are going to loosen up or fail, and these are the solutions on what to do if that happens. So I hope that's been helpful to you. And as always, myself, Dr. Dave, Dr. John, Dr. Dave Powers, Dr. John Lucchese, or myself are available anytime to assist you, answer questions. You can email us, text us, call us anytime you want if you have any questions or problems. I'll talk to you next time on the Monday Morning Minute. Thanks for being here.
Good morning, everyone. We'd like to thank everyone who came out to Las Vegas last weekend for our first in-person course in quite some time. And it was wonderful. We had over 55 doctors in attendance, and the people who came, I think it was just excellent. We got a lot out. The people who were there got a lot out of it. And thank you so much for coming out to Las Vegas. It was great having everyone out there. And I want to let everybody know that we're right back here in Buffalo. We're going to have our advanced course on March 11th and 12th here in person. Dr. Shakin will be doing live surgery at that event, and Dr. Matthew Lasorsa is going to be doing a full day of LPRF on Saturday, March 13th. Please visit our website at shakinfirst.com so you can see our upcoming courses. We're going to have a course in April, May, June. We're going to be down in Orlando, Florida in Disney World at the Boardwalk Resort, which is absolutely beautiful, in August. And then we're going to have an excellent International Academy of Mini Dental Implants meeting in Nashville, Tennessee on September 24th and 25th. So get it on your calendar now so we can see everybody down there. It's going to be an unbelievable event. I also wanted to remind everybody to start using the N95 masks. We have them in stock. We're selling them for $2 a piece in boxes of 25. We make them in ear loops and headbands. No better way to keep healthy than using the N95 Shakin First masks. I also wanted to talk about our whitening system. The iSmile whitening, no zingers, no sensitivity. We have an in-office treatment as well as a take-home kit. Call and ask Nick, Kevin, or anybody at Shakin First about it. It's a great way to keep your patients happy and keep their teeth very white. And the last thing, since it's Nick Carzo's birthday this week, crystal clear aligners. It is such a phenomenal way to straighten teeth. Very few times do we have to use attachments, very little IPR. If you're interested in getting started with the crystal clear aligners, call Nick Carzo at 1-888-4SHATKIN, and he'll tell you everything you need to know, what you need to send in to get started placing the crystal clear aligners. We hope you have a wonderful week placing the mini dental implants in your office, and we look forward to seeing you out in Buffalo, but more importantly, we look forward to seeing you on the next Monday Morning Minute.